This is an irregular pneumatic bone, ethmoid. What are the parts of this bone? There are mainly three parts. Two lateral muscles, one on each side, called labyrinthine, and this part which connects the two labyrinthine, this plate of bone called cubiform plate, and one perpendicular plate, this one projecting downwards from the under surface of this cubiform plate called perpendicular plate. Why it is called pneumatic? Pneumo means air. The labyrinthine or this lateral mass, it contains ethmoidal air sinuses. That means air-filled spaces. So it is called pneumatic bone. Then come to the cubiform plate. This plate having upper surface and lower surface. And this is called crista galli, and this is the posterior border of the cubiform plate. What is the meaning of cubiform? Cubiform means it is sieve-like and presents numerous small aperture on each side of the midline, through which the olfactory nerves from the nasal cavity, which is present on each side of this perpendicular plate, enters into the cranial cavity onto the surface. And there are about 15 to 20 foramina on each side. And the cubiform plate having two surfaces, upper surface and one lower surface. And this triangular crest is called crista galli of ethmoid. Then what you will get on this surface? Here you will get mainly two important structures. One is olfactory bulb and continued as olfactory tract, and gyrus recti of the inferior surface of the frontal lobe of cerebrum. Then come to the crista galli, which structure is attached to the posterior border of the crista galli. There is attachment of anterior end of the falx cerebri, which is a fold of dura mater. And anteriorly, this crista galli, it diverges into two wings called ala. And this ala, it articulates with the frontal bone and forms the foramen cecum. This is frontal bone, and when it articulates, it forms a foramen here. This foramen is called foramen cecum. Small foramen between the crista galli of the ethmoid and the frontal bone. And this foramen cecum, usually it transmits no structure, but sometimes an emissary vein passes through this foramen, which connects the superior sinus with the veins of the nose. So any infection, if it occurs in the nasal cavity here, the infection from the nasal cavity passes through the foramen cecum and it enters into the superior sinus, and it comes backwards to the sinus, then turns right to the right transverse sinus, and from there via the superior petrosal sinus it reaches the cavernous sinus, which is present on each side of the hypophyseal fossa on the upper surface of the sphenoid bone. That means the infection in the nose may produce meningitis or cavernous sinus thrombosis. And this is posterior border. It articulates with the ethmoidal spine of the body of the sphenoid. This is the ethmoidal spine. It articulates with the posterior border of the cubiform plate like this. From the under surface of the cubiform plate, if I turn it, you can see this is perpendicular plate. It is a quadrilateral plate and it forms the part of the nasal septum. Nasal septum, it is formed mainly by two bones. One is this ethmoid and one is vomer. This perpendicular plate of the ethmoid, it forms the upper and anterior part of the nasal septum. Lower and posterior part of the nasal septum, it is formed by the vomer. Then come to the labyrinth. These two lateral muscles called labyrinth. This labyrinth or lateral mass contains a number of thin walled cellular cavities all these are cellular cavities. These are called ethmoidal air sinus. Ethmoidal air sinuses, they open into the different meatus of the nasal cavity below. Labyrinth having four surfaces, or a lateral surface or called orbital surface, then medial surface or called nasal surface because it forms the lateral wall of the nasal cavity, and the superior surface, and this is posterior surface. So four surfaces: orbital or lateral, nasal or medial, superior and posterior surface. This orbital surface, this one, it is smooth. It forms the middle wall of the orbit. So here, this middle wall of the orbit, on this side, it is formed by this orbital plate of the ethmoid bone. On the medial side or medial surface, it forms the lateral wall of the nasal cavity. This is, my probe is in the nasal cavity of one side, this is nasal cavity of other side, and in between these two is the perpendicular plate of ethmoid, which divides the nasal cavity into right and left halves. So this medial surface of the labyrinth, it forms the lateral wall of this nasal cavity. There are multiple number of ethmoidal air sinus within the labyrinth. On an average, there are 11 anterior ethmoidal air sinus or air cells, about 3 middle ethmoidal air cells, and about 6 posterior ethmoidal air cells. And on the superior surface of the labyrinth, there are two small groups, one anterior, one posterior. This group, called the anterior and posterior ethmoidal groups, which are converted into anterior posterior ethmoidal canal by its articulation with the frontal bone. And the structures passing through these canals are the anterior and posterior ethmoidal vessels and nerve. And a thin hook-like process from the posterior inferior part of the labyrinth is called the uncinate process of ethmoid bone. It articulates with the ethmoidal process of inferior nasal concha. In the medial surface, there are mainly two elevations. This is the under surface, this is perpendicular plate of ethmoid bone, and this is a labyrinth, it is its medial wall. Here you can see one elevation, elevated bony elevation. This is called superior nasal concha, and above this one is a meatus called sphenoethmoidal recess. Here the sphenoidal air sinus drains, and the fissure between the superior and middle concha, this is middle concha here, is called the superior meatus. In the superior meatus, ethmoidal sinus open is the posterior ethmoidal air sinus, and this space lateral to this elevation or middle concha is called the middle meatus. And in the middle meatus, there is an elevation that is called bulla ethmoidale. This is bulla ethmoidale. This elevation is due to the presence of middle ethmoidal air cells, which open into the middle meatus either on the bulla or above it. I am holding this bone in anatomical position. This is the upper side because here you can see the cavivum plate and crista galli, and the lower surface having the perpendicular plate of ethmoid bone and two lateral mass. This is the anatomical position of ethmoid.